I gave birth to Seed Global Health 3 weeks before I gave birth to my son, which makes sense because this work for me has always been incredibly personal. I grew up in a house of public service where I had two parents who both tried to advocate for those who couldn't always advocate for themselves. And I had a chance to be exposed to the many disparities that people lived in the world. So that when I went to medical school and through my training, I had the chance to go spend time in Africa and work as a physician, and I saw more disparities. And I would see people fly in, deliver care, and fly out, and they feel good about themselves, but nothing actually changed where they were on the ground. As a physician, it's my job to nurture and heal. And as a mother, it's my job to nurture and protect. And that means, for me, trying to tackle some of the biggest problems that are happening in the world. But this story is not about me. It's about the 83 countries around the world that have critical shortages of doctors, nurses, midwives, and other healthcare workers. And it turns out that those 83 countries around the world also have the largest burden of disease. So this is from worldmapper.com, and whether you look at the countries that make sense, that are fatter, have more disease, and whether it's under 5 mortality, maternal mortality, cardiovascular disease, malignancies, infectious disease, trauma, the map looks the same. So what that means for the continent of Africa is that it has 75% of the world, 70 to 75% of the world's HIV, a quarter of the world's overall burden of disease, only 3% of the world's healthcare workforce, and only 1% of the world's healthcare expenditure with which to rectify that. Why does it matter? If you think about the Ebola outbreak of 2014, a single case in Guinea, because there weren't enough health professionals to be able to see what was happening, to sound the alarm and mount the response. A single little case in the 3-year-old in December of 2013 led to 28,000 infections, 11,000 deaths, $53 billion of economic hit and downturn. Spanned 6 countries, 3 continents. The worst part is, there were probably more deaths from the disruption of health services from measles than there actually was with Ebola alone. The bottom line is that health is integrated into everything you do, whether you can go to school, economic growth, national security, our ability to not just survive, but to thrive. There's economic data, tons of it, that links that better health leads to better economic growth. Countries that intentionally invested in health had economic booms. In Zambia, there's a study done that when the main breadwinner died of HIV, 2/3 of the households had an 80% decline in income, 60% lost access to their housing, 40% lost access to running water, 21% of girls in those houses stopped going to school, and 17% of boys. There's stability and security data now too. We know that countries that end up getting investments in health actually have better markers of safety and security. They do better on regulatory things, better on governance, better on corruption. They have a better ability to deliver services to their country. And it just makes sense. If a government can't provide health services to its people, you have to wonder how much you can trust it. You can put as much weight in that statement as you want. The thing is, we've made a lot of very meaningful interventions in health over the last 30 years. We've put billions of dollars into HIV and put people on treatment. We've done an incredible job of dropping maternal mortality. We've made huge progress across a number of health parameters. But we still face many massive health issues around the world. We are far from done from closing these 2 standards of care in the world. And if you think about it, the one thing we have never done in 30 years of making these investments is to invest in people. People are the heart of the health system. Even in a digital age, healthcare is human-centered. You will never have a robot be able to be on the front lines of care. So what Seed does that is very different from other organizations is that we train one doctor or one nurse or one midwife that will go on to train 10 more, and so on. They can not only provide care directly and train their successors, but they can train across the entire healthcare spectrum, solve problems, and become agents of change in their country. What that has looked like is that over the last 5 years, we've trained over 16,000 doctors, nurses, and midwives in 5 countries, providing service to over several hundreds of thousands of patients over that time. But really the reason it matters is because it's the right thing to do. This is Salome Carla. She's an Ebola fighter. She's a nurse who spent on the front lines of the Ebola epidemic, caring for patients when she contracted Ebola herself. She was the face of the Ebola fighters in 2014 as Times Person of the Year. She got sick from Ebola. She's one of the few that recovered. And she went right back to work taking care of others. She died 2 years later in childbirth because there wasn't a midwife to take care of her. Thank you.